Leptospirosis is a bacterial disease of both animal and humans. It is caused by the Leptospirobacteria and is found in infected animals' tissues and in infected urine. Symptoms of leptospirosis are similar to that of the common flu and can include fever, headache, sore muscles, chills, vomiting, and red eyes. Most people only get a few of these symptoms. However, leptospirosis can also lead to a more serious condition called Will's disease. Symptoms usually develop between 5 to 14 days, and infection can last for 3 weeks or longer. Recovery is usually slow. Leptospirosis is a zoonotic disease and can be transmitted from animals to humans. It can be acquired through skin cuts and abrasions and through the linings of the eyes, mouth, and nose. It can also be acquired from close contact with infected animal urine. Those who live in tropical areas such as New South Wales and Queensland are more at risk of acquiring leptospirosis, as the Leptospirobacteria lives in water and is commonly found in floodwaters that are infected with animal urine. However, with this said, person-to-person transmission is rare. So who's at risk of acquiring leptospirosis? Those that have had contact with animal urine are more at risk, as Leptospirobacteria can be harboured in the kidneys of infected animals and shed in their urine for a long period of time after the initial infection. Therefore, those that have also had contact with soil and vegetation that has been contaminated with infected animal urine are also at risk. High-risk occupations include abattoir workers, veterinarians, and banana farmers due to their close contact with potentially infected animal tissue and urine. Furthermore, men are more likely to be infected than women. Preventing leptospirosis is simple. You should ensure that you always cover cuts and abrasions with waterproof dressing and always wear personal protective equipment when working with potentially infected animals. This could include goggles, aprons, boots, eye masks, and gloves. You should always wear gloves when handling aborted fetuses and placenta. Personal hygiene is also important. It is important to always wash and dry your hands after being in contact with potentially infected animals and avoid eating and smoking when handling infected animals. You should also avoid yourself and your pets from entering floodwaters, as they could be contaminated with Leptospirobacteria. If you suspect that you've acquired a leptospirosis infection following possible exposure to infected animal urine or a contaminated environment, it's important that you go see a doctor immediately, as leptospirosis is a notifiable disease. Diagnosis requires 2 blood tests taken 2 weeks apart, and following a positive diagnosis, your doctor will prescribe you antibiotics such as doxycycline or penicillin, which will help treat your leptospirosis infection. These antibiotics are most